Now, to a lot of people, the issue of the Ebola virus came as a surprise. Many today have never heard about it or probably just read about it. So when it was announced that somewhere on the continent of Africa, the virus had again re-emerged, some people would have been shocked. What exactly is Ebola virus? Now, Ebola virus disease, or EVD, or Ebola hemorrhagic fever, EHF, is a human disease that may be caused by any of 4 of the 5 known Ebola viruses. Again, we're back to that term, Ebola virus. These 4 viruses are Bundibugyo virus, Ebola virus, Sudan virus, and Thai forest virus, formerly and more commonly known as Cote d'Ivoire Ebola virus. EBD is a viral hemorrhage fever and is clinically nearly indistinguishable from Marburg virus disease. Now, these are all terms that will sound real strange to a lot of people. Where are they coming from? Is it the end of the world? No, it's not the end of the world, but someone's here that will help us understand exactly what the Ebola virus is, how it comes, how it affects the human system, and how it can be prevented as much as possible. Dr. Ismail Abdul-Salam, I hope I got it well. He's a consultant public health physician and state epidemiologist from the Lagos State Ministry of Health.
Yeah, good morning.
Good morning, and thank you for coming.
Yeah, thank you very much.
Now, West African nations scrambled on Tuesday, March the 25th, to contain an outbreak of the Ebola virus, which is said to have killed about 59 people in Guinea. But this is not the first time this virus is showing up. I mean, we're hearing about this. So what's the history and what's the situation with this?
Well, Ebola virus disease, or Ebola virus hemorrhagic fever, was first discovered in Africa, in northern part of a river in Zaire. That is 1976. And that period, the epidemic was very, very serious. At least as of that time, we have 88% of those infected died. That is case fatality rate. That's very high. And in 1976 also, the same period, we have another epidemic occurring simultaneously with the one of Zaire in Sudan. And the case fatality rate, or the infection, those that died, out of the people infected, were about 59%. Now, Ebola virus hemorrhagic fever is caused by a virus known as Ebola virus, and the same family with the Marburg virus, the same family with the yellow fever virus. Virologically, they call it the Filoviridae family. So they were responsible for this particular infection. And I think to add to it, on the 23rd of March this year, the Ministry of Health of Guinea informed the World Health Organization of epidemic of Ebola virus in that country. And currently, as we are talking now, as of April 1st of this year, 127 people have been infected. We have 83 deaths, which gives us about 65% of those that are infected died. And this shows that a very, very deadly disease.
Now, what's the source? When you say it was discovered in 1976 in Zaire, then Zaire, now Democratic Republic of Congo, where was it discovered?
Well, maybe the question we should be asking, because if you have an infection, you want to know the reservoir of that infection, and then you want to know the route of transmission or the method of transmission of that infection. Well, the reservoir of infection has been linked to primates, animals. We are talking about bats, especially here, has been incriminated, especially the one that we are talking about now. And other animals like monkeys, chimpanzees, and gorilla has also been linked as the one that are reservoir. The reservoir in the sense that they harbor the virus lives and multiply in them, and at the end of the day, they do not do any harm to those reservoir of infection, but the heart as a source of transmitting this particular infection. Now, this can come out of close, contact with the animal itself, with the body fluid of that animal, with the blood of that animal, or secretions of that animal. So if human being comes in contact with all these things we have talked about in the animal, then surely they will contact that particular virus and probably develop that particular infection. And apart from that, there is person-to-person transmission. That's in terms of human being. You have an infected person, even direct physical contact with that particular person, with the blood, with the body secretion, with the body fluid of that particular person can, result into infection.
It's not transmitted by breath.
Well,
there has to be a contact.
Well, aerosol has also been incriminated as, that you can contact the infection by inhalation. But that has not been very much documented. It is not that it's not possible, it's possible. But the direct contact we're talking about in terms of those that are infected, contributes more to this, infection. And apart from that, before I stopped on that, direct contact, even with the dead body, and that is where the aspect of burial also comes in terms of people that die from this particular infection. A lot of care has to be taken. People that are going to, do the normal ritual, the burial need to be highly protected. They have to use personal protective equipment that are specialized for this particular type of infection.
Okay. Now, it's been described as a very rare disease. I mean, Esther Sturck, a tropical disease specialist, said it's a very, very, though dangerous, but it's very rare. But the incubation period has also been put at 2 to 21 days.
And
so,
sometimes maybe 5 to 21 days, but majorly, have a long range of 2 to 21 days.
That's how long it takes for the fatal period. Now,
Yeah.
what are the signs and symptoms?
Well, here, that is where, the infection itself, just like, Marburg, just like Lassa fever, even yellow fever, some of these viral hemorrhagic disease that are also called, zoonotic infection, that is, they are infection primarily of animal, that is transmissible to man, you have the normal, non-specific symptoms, like somebody that is not feeling fine. Maybe you have acute fever, you have malaise, you have muscle weakness, the person now starts complaining of sore throats, you have difficulty in swallowing. It's common to major infections. So that is how it starts. And that is why the health worker too will not be able to, ab initio, you may be able to know that this, you might be treating malaria, might be treating common typhoid fever, treating other things. But as the infection progresses, you now start having, symptoms or signs like vomiting, passing blood via the normal, different kind of openings within the system, especially the rectum, passing blood by rectum, passing blood, you can have nose bleeding, you can have vomiting of blood through the mouth, you can have bleeding coming out from the hair, you can have bleeding into the skin, which, normal medical term is called purpura. These are ways it can come. You can have even into the eyes, conjunctival injection with hemorrhages in the eye. So that can also come, and that is also similar to all these other viral hemorrhagic fever, like Lassa fever, like yellow fever, like Marburg, like dengue. Because if you know, on Saturday, that should be 20, so I can't remember, Saturday, last week, you can see that the minister to dispel the rumor of a case in Nigeria. Actually, you have a case, of viral hemorrhagic fever in Nasarawa, the blood taken to Abuja, and from there sent to Lagos, the virology reference lab, because that one they had carried out the test, PCR for Lassa fever, and it was negative. So they had to send it down. This is the period we have Ebola. Is it Ebola? But at the end of the day, it was negative for Ebola, but it was actually a strain of dengue fever.
I was going to say that these symptoms are similar to symptoms that occur when you have other illnesses. You talked about extreme fever. Now, that could come when you're having malaria. So it's just scary. At the end of the day, what do the people need to do?
Well, in this case, we will look at the people from, looking at, because the health workers are highly at risk of contracting this infection, because you need to have high index of suspicion to take care of the patient. And you might not even know when you are dealing with a patient that had, this viral hemorrhagic fever. Now, generally, if you look at, the general members of the public, anyone that has, these non-specific symptoms, treated for malaria and is not subsiding, treated for other illness not subsiding, and now having any of those symptoms we talk about, maybe any of the bleeding problems, maybe passing blood by rectum, and nose bleeding, even at the stage you are having that, the infection has really progressed. But especially when you have people who comes down from that area and they develop any of these symptoms, then we have to have high index of suspicion by the health workers. That is one. Two is that when we look at the route of transmission of this infection, we are talking about infection from wild animal to human being. It means that we have to take extra care when dealing with animals and animal products, such that you need to have protective devices used. Even in touching the animals, you need to wear gloves so as to prevent having this particular infection. Very, very important. And then when we finish with such animal, regular hand washing is very, very important in this particular respect. Secondly, if there is any infected case you are aware of, avoidance of contact with those infected cases, very, very important. And avoidance of contact with dead bodies of those that are infected and they die. Avoidance of contact, very, very important. And within the healthcare setting, there is need for universal precaution, even attending to any patient at all, which is what we do under normal circumstances, because it's very difficult for you to know which patient will progress to have that particular infection. So universal precaution, the use of specialized personal protective equipment in this regard is very, very important. And then I will stress more on the hand washing, very, very important, with soap and water, regular hand washing.
Wait, when you say soap and water, is it normal soap? Normal
soap and water, because it's suspicion. We are not sure. Even with the virus, you use the normal soap and water to wash your hand.
And it takes care of it.
That is, you must have used personal protective equipment, because we are not saying you should have contact or touch